From Lagos, the nation's commercial capital, this is the news at 10, live from Channels Television. Reporting tonight,
W.H.O.
Hello and welcome. Tonight, United States government gives Nigeria thumbs up for what it calls good management of Ebola virus disease. Federal government denies reports that over 600,000 people have been displaced in the northeast of the country, says report is untrue. Pengas and Newpeng on collision course with W.H.O over gas maintenance contract in Port Harcourt. And Israel responds to Gaza's rockets, carries out airstrike against the city.
And on Business News tonight, President Goodluck Jonathan approves the release of 220 billion naira micro, small and medium enterprises development fund.
And on sports news tonight, Nigeria Football Federation calls up 23 players for next month's 2015 Africa Cup of Nations qualifiers against Congo and South Africa.
I'm Linda Kibe, and from Abuja, House Committee on Education tackles Finance Ministry over alleged poor funding of the education sector in the country.
Well, we begin on this sad note tonight that the most senior doctor who participated in the management of the index patient of Ebola in Lagos has died. The Minister of Health, Professor Onyebuchi, said in a statement that the death of the female consultant physician occurred this evening. Dr. Ameyo Stella Adadevo, a senior consultant physician and endocrinologist with First Consultant Medical Center in Abalinde, Lagos, had unknowingly contracted the disease in the process of treating the late Liberian-American Patrick Sawyer, who imported disease into Nigeria late last month. With this unfortunate development, the total number of Ebola virus-related deaths in Nigeria now stands at 5, including the index case. The other 2 patients currently under treatment are said to be stable. Now, before this sad announcement, Nigeria's health officials had been given a thumbs up by the United States government. The U.S. Consul General, Mr. Jeffrey Hawkins, confirmed today that the U.S. is pleased with the steps taken so far by the Nigerian government to contain the disease. He also revealed that the U.S. Center for Disease Control is also involved in the containment of the disease in the country. Our health correspondent, Yomi Otaigbe, reports.
Coming on the back of the U.S. ambassador to Nigeria's visit to the health minister, the U.S. Consul General, Mr. Jeffrey Hawkins, and the team leader for the Center for Disease Control involved in supporting Nigeria's efforts at containing the Ebola virus disease are here to highlight the role of the U.S. in the Ebola threats.
The CDC team, as I mentioned, about 8 people right now. They are all very firmly integrated into the Emergency Operations Center here. And we've been able to provide expertise in a number of different areas across the spectrum, from general response to outbreaks such as this one, to port health security, to protective personal equipment, across a whole range of areas. And again, taking leadership from the Nigerian side and figuring out what they need.
There is not a cure for Ebola, but there is effective treatment. The effective treatment involves monitoring the patient at the facility looking at things like the amount of fluid that they need, looking at whether they need electrolytes, other issues that come up with the patient through their course of disease that can be managed. And if those services are provided, the number of people who survive the disease goes up considerably. And so it's been very reassuring that those patients have been receiving that care, and that care has resulted in some of them being able to go home.
Since the announcement that some of the Ebola patients have been discharged, some people really welcome this news with cautious optimism. Why? Because they've been told that Ebola has no cure, Ebola has no treatment. So how come these people are well enough to go home?
Because of the nature of Ebola, there's actually a very specific plan that is followed before a patient is discharged. And by the time the patient is discharged, they're not at risk of transmitting the disease within the community. It's a very positive story, and I would hope communities would welcome people back and be glad that they have them coming out of the facility, knowing that they, like other diseases, that they went through the disease, they survived it, and they're not a risk to the community. They're part of the community.
One of the messages the U.S. Center for Disease Control is leaving behind is the same message that the Nigerian health authorities have been propagating, and that is the Ebola virus can only be transmitted when a person infected with the virus is down with the sickness. And if you or anyone around you have the symptoms, don't hide yourself, because early detection is very crucial to survival. Yomi Otaibo reporting for Channels Television News.
Well, from the north to the south, it appears nothing is being left to chance as groups organize sensitization programs for the different target audiences. In Lagos and Kaduna, enlightenment campaigns are being put in place for labor unions and rural dwellers. Our correspondent Mary Alale Yusuf reports.
Concerned about the spread of the Ebola virus disease in Nigeria and West Africa, the National Union of Textile, Garment and Tailoring Workers is gathered here with some doctors.
The truth of the matter is,
the agenda of this gathering of the National Union of Textile, Garment and Tailoring Workers of Nigeria and members of other unions in Lagos is to prevent the Ebola virus disease from making inroads to their workplaces. Participants comment more on the dreaded disease.
if Ebola is discovered in some neighboring West African countries that have fewer or lesser population, it may not be news. But if Ebola comes to Nigeria with about 160 million people, comrades, that is catastrophic.
This sensitization is put together to address what I call the 6 W's of Ebola virus disease. Namely, what is it? Who can contact it? Where can it be transmitted? How can it be contained? Where can it be fatal? And which measure can be taken?
Up north, journalists in Kaduna are determined to disseminate information, even in remote parts of the state.
We are going to go around, by the grace of God, to hold town hall meetings, not at local government headquarters, but at the most inner part of rural area in a particular local government, so that this message can spread. We have the tools, and we have the medium to ensure that this thing goes round.
The awareness is spreading.
After getting down, I make sure I wash my hands before touching anything or before eating.
As the message gathers momentum, it is hoped that people would comply with safety regulations, as this would help reduce the chances of the virus spreading. Everyone is from a family, and people in families work. When people don't observe good hygiene, they can spread germs to members of their families and colleagues through their hands. So the first and the best rule is wash your hands often. Mary Alale Yusuf, Channels Television News.
In the meantime, health authorities have refuted the story in some sections of the media that 3 new Ebola cases were discovered in Makurdi. The Permanent Secretary, Primary Healthcare Board, Lagos State, Dr. Ogutimei Olukayode, said that the media needs to get their facts right before publication. According to him, the monitoring of all those on the contact list is still on to make sure they are free of the Ebola virus.
What we need to do is this. Anybody who's on the contact list, we monitor them. They have thermometers. We go to see them. As soon as they pick up a fever, we bring them in. And then we test. When we now have a confirmation, then we pull them in as a case. But because we're pulling them in is basically for assurance that if this person actually has Ebola, it's not right out there. I think our press should actually ask for more information because this causes...
No, we don't know whether this is in Lagos, because what we're saying, if you look at the rider to that paper, you have 3 persons quarantined in Makurdi. Are you also keeping a tab as to what is happening across the country?
Yes, there's nobody that has been quarantined or has been suspected all over Nigeria right now that has tested positive.
Now also, the federal government has praised the courage of medical personnel in Lagos who tried to save the life of the Liberian-American carrier of the Ebola virus, Patrick Sawyer, and got infected in the process. On the occasion of the 2014 World Humanitarian Day at the Presidential Villa in Abuja, the Vice President Namadi Sambo also expressed concern over increasing cases of violent attacks on humanitarian personnel across the world. He said that in spite of their passion to save lives, humanitarian workers have become targets of hostilities in the course of discharging their duties.
As you are aware, the theme of this year's event is more people than ever before need our help. Therefore, we are all enjoined to become messengers of humanity. I wish to state further that honoring humanitarian workers today provide the government the unique opportunity to recognize, encourage, and inspire others in delivering selfless service to humanity and bring succor to the families of those who may have lost their lives or suffered severe injuries due to their exposure to life-threatening situations.
In part 2, after the break, the Independent National Electoral Commission creates 30,000 more polling units ahead of the 2015 general elections. That's in a moment. Do join us again.